much for the opportunity to speak with you today. I'm going to review some of the evidence that exists for nutrition in macular degeneration, which is a very important component of preventing progression of disease. And then I'll have time for your questions, and we'll also address some of the controversies that are going on these days in terms of the supplements for macular degeneration. So first of all, why is diet important in AMD? Well, I'm sure every time you go to the doctor, your diet is important for everything, whether it's your blood pressure or your heart, cholesterol, everything else. And just the same, it's important for macular degeneration. We know that AMD is one of the leading causes of vision loss in older adults in the developed world. And most of the treatment we have really focuses on people who already have advanced forms of disease. So, there are many risk factors for macular degeneration, such as diet and aging, smoking. Now, you can't do anything about getting older, but you can do something about your diet. It's a modifiable risk factor. So, as the population gets older and there are more and more people with AMD, anything we can do to modify the risk factors that will help prevent it from getting worse is really, really important. So, why do vitamins help? We're going to focus on a few different vitamins, the ones that have the more evidence in the literature. Now, there's a ton of different supplements that you'll see when you go to the drugstore. Not all of them are evidence-based, so we'll focus on the ones that do have evidence. So first, lutein and zeaxanthin. Those are both antioxidants, and they're called carotenoids, which belong to a family of pigments that are found primarily in plants, and especially in green leafy plants. And they are stored in animal tissues, but at much lower concentration. So essentially, they're kind of a yellow pigment. So if you think of anything yellow like corn or egg yolks, that contains carotenoids. And they're also in green leafy vegetables. And they're important because high oxidative stress can cause damage in the retina. And these are antioxidants, so they help to prevent that stress from happening. And so they may also help protect against UV light or blue light damage to the back of the eye. The other nutrient that we'll be talking about is omega-3 fatty acids, or DHA and EPA. And they're an important part of the photoreceptor cell membrane. So the photoreceptor is the nerve cell in the eye that is responsible for vision. And that's the cell that collects all the information and sends it along to the optic nerve and to the brain for sight. So the membrane of these cells is actually made up of omega-3 fatty acids. So that's why having good intake of those nutrients is important. In addition, we'll also be talking about vitamin E and vitamin C. And another thing that patients always ask me is, where do I get these in my diet? Not everybody wants to be relying on supplements to try and be able to get all these nutrients. And a lot of people, as we get older, we forget to think about having a very well-balanced diet. So as I talked about, green leafy vegetables is a very important source of carotenoids. Any colorful fruits and vegetables, yellow peppers, corn, those type of things are also helpful. DHA and EPA, the omega-3 fatty acids, come primarily from cold water oily fishes who get the nutrient from algae or plankton. So if you're a vegetarian and you don't eat fish, you can get it through algae oil. You can also get it through flaxseed oil, but that has a much lower rate. So oftentimes we recommend that people have 2 servings of fish a week, or they take a omega-3 acid supplement. Vitamin E is also found in vegetable oil and nuts and green leafy vegetables and in some fish. And vitamin C, as we all know, is found in citrus fruits and vegetables. So the next question is, what is the evidence for these nutrients? Why do we recommend them? Why is it that every time you go to the ophthalmologist, they tell you to take these supplements and eat a healthy diet? So some of you may have noticed that, those of you who are already on these supplements may have noticed that when you go to the doctor in the last year, they maybe have been changing the supplements. They might say, okay, stop taking the beta-carotene. Okay, you don't need to take the omega-3s. Take this pill instead of that pill. And you might be wondering why that is, especially because some of you may have been on these supplements for a very long time. I know that I've been doing this with my patients, some of you who I see are in the audience today. And the reason for that is because there was a new study that came out, or part 2 of a big study that came out in May of 2013. It's the Age-Related Eye Disease Part 2 study. And essentially, they enrolled over 4,000 patients at 83 centers across the U.S., and they took patients who were aged 50 to 85, and they essentially tried to see what combination of nutrients or vitamins was most helpful in preventing the patients from getting their AMD from getting worse. So these are patients who already had a medium degree of disease, not patients who had mild, not patients who had very, very severe, people who had a medium degree of disease in both eyes, what we call intermediate AMD, or who had really bad AMD in one eye and intermediate in the other eye. So one eye was wet, or one eye had lost vision because of loss of tissue or atrophy, and where the other eye was at risk. So they took patients at high risk, and they took these supplements, and they essentially, it was part 2 of a study that was done several years ago, so they took all these nutrients and they modified them. So what did they do? Just not to bore you with the specific details, but they had initially a vitamin that had vitamin C, vitamin E, beta-carotene, zinc, and copper, and then they played with it. So they added lutein and zeaxanthine, they took out the beta-carotene, they reduced the dose of the zinc, and they added omega-3s. So there were several different arms with all the different combinations of this vitamin. And they said, okay, what happened to these patients? How many people got worse? Did it prevent the rate of progression to advanced macular degeneration? And so they had some interesting results, which is why a lot of doctors have been changing the vitamins that you've been on or telling you to adjust what you're taking. And so what they found is that adding the omega-3s didn't really make a difference one way or the other. It didn't hurt, but it didn't really help. So that's why some of you who've been on the pills with the omega-3s may have been told it's okay, you don't need to take the omega-3s. Secondly, they found that patients who had the vitamin that had lutein and did not have beta-carotene actually had less progression to advanced AMD compared to the people who had just the beta-carotene and no lutein. And so this was a really interesting finding for doctors, because the reason is that the lutein and beta-carotene compete for each other for absorption in the body. So when you give both together, one is not being absorbed as well as the other. And so patients who had the lutein and didn't have the beta-carotene actually had about an 18% lower risk of their macular degeneration getting worse to the advanced stage compared to the ones that had taken the beta-carotene. So this is a big reason that we've now been telling people to take the supplement that doesn't have beta-carotene and contains lutein. And also we found that even if you had quit smoking more than a year ago, taking beta-carotene did increase the rate of lung cancer by 2%. These were in people who were former smokers, but they smoked 20 years ago or 5 years ago. We don't know how long they quit smoking. But it was people who had quit smoking more than a year ago, the beta-carotene still increased the risk of lung cancer. So based on the fact that the beta-carotene didn't seem to help as much as the lutein, and maybe there's an increased risk of cancer, we've been telling patients to stop taking the supplements that contain the beta-carotene. And if you go to the drugstore, most of the companies have switched their formulations now to get rid of the beta-carotene for that reason. And almost all of them contain the lutein. So I think that's a really important point. For those of you who are not sure what you're taking, it may be worthwhile to go home and take a look at the box and see what's on it. And also check with your doctor as well. Also, they found that people who didn't have a very healthy diet, so maybe they didn't eat a lot of green leafy vegetables or yellow fruits and vegetables, they found that those patients had an even greater benefit from the supplement because they didn't have enough in their diet. So that does show if you have it in your diet, then you didn't have as much of a benefit from the supplement. Also, they adjusted the dose of zinc, and they didn't really find it made a difference one way or the other. So essentially, who should be taking these vitamins? Again, as we talked about, it's really patients who have an intermediate risk of macular degeneration. So what does that mean? A best way for you to find out what your stage is to ask your eye doctor, because it really depends on the number of little spots in the eye. So there's little spots, I'm sure you heard about them in the other talks, called drusen that collect in the back of the eye in patients who have AMD. If you just have a couple of these spots, you're probably either very early or almost no macular degeneration. The supplements didn't make a difference in these patients. It really helped for patients who had several of these spots of bigger sizes or who had advanced disease in one eye and intermediate disease in the other. And so I know I see a lot of patients who come in with early macular degeneration who are on these vitamins, or they have a father who has macular degeneration. They say, hey, if my father already has it, maybe I should take it now so that I don't get it. So the vitamins didn't work that way. It really was for people who already had an intermediate degree or middle stage of damage in their eye already. Those are the ones where the supplement showed the benefit. So the most important thing would be for you to ask your doctor, and find out how bad your stage is, or what is your degree of macular degeneration, so that you can then know whether you should be taking the supplement or not. Also, if you are wet in both eyes already, or you have very severe vision loss in both eyes already, the supplement didn't show and benefit in this group already because they've already lost vision. Does that mean it's going to hurt you? Not necessarily, but there's not as much room for prevention because the damage is already done. So another important thing, I think, which is, I know several of my patients have asked, and I think there are people here who have booths here today as well, is what about the roles of genes? How does my genetic makeup affect the benefit from the vitamins? And this is a big area of controversy in the macular degeneration research population right now. And so there's kind of two camps. There's the camp from this doctor, Dr. Carl O. from Tennessee, and essentially he's published several papers saying that depending on your genes, the vitamins could potentially make your eye worse. And of course, this is a huge concern to anybody who's taking the vitamins or any doctor that's prescribing the vitamins, because, the first rule of medicine is don't make your patients worse. Do no harm, and you want to always help. And so what they did is they purchased the genetic information from the National Eye Institute, from the main group that did the studies on the vitamins, and they took a subset of those patients and they tested their genes, and they analyzed the genes. And they said that depending on your combination of genes, that if you had this complement factor H, or you didn't have that, or you had this other gene, ARMS2, then it was better if you only took zinc. But if you had another combination of those two genes, it was better if you took the vitamins and no zinc. And then they said that if you had another combination, maybe the zinc could make you worse. So this is a big area of controversy, of course, because we have been routinely recommending these vitamins for several years now to all patients. And of course, when this research came out, everybody was in a flutter because we wanted to make sure we were doing the right thing for our patients. And so there's some things their studies have been subsequently analyzed in a lot of detail to make sure that, the results were reproducible by other groups. One of the main things that kind of has caused a stir within the medical community is that the doctor in the group that came out with these results are also funded by the companies that do the genetic testing. So there's a worry about bias potentially, because it's in their benefit to say that, everybody should get genetic testing done for macular degeneration. And so they've also tried to, again, reproduce this data, and they haven't been able to do so. So still, what does this all mean? That means that we do not recommend routine genetic testing for patients with macular degeneration, and further research is needed, but for the time being, everybody should continue to take their vitamins. So don't be worried that if you take your vitamin, your eye might get worse, because this data has not been able to be reproduced by any group who is publicly funded or doesn't have an inherent bias in wanting a particular result. So I know that a lot of patients have mention this to me, so I wanted to make sure that I'm sure this is out there. So please, be confident that the vitamins are not going to necessarily make you worse. Take a vitamin that has the lutein and the zeaxanthin and no beta-carotene. The dose of the zinc doesn't matter. And if you want to take your omegas, you can. But if you don't, it's okay. Because if you take the omegas, that's 4 tablets a day. If you don't take the omegas, it's 2. So that might be easier for some people. And it's okay to eat your carrots just because, you're worried about getting beta-carotene. It's not about diet. We're talking about supplements. So, doctors always said carrots are good for the eye. That's still the case, even though we say no beta-carotene in a pill. And we don't have any recommendation at this time to recommend routine genetic testing for everybody. If you're interested in having that done, there's certainly no harm. Discuss it with your doctor. But it's certainly not mandatory, and it's certainly not something that people are going to have to feel worried about paying the cost for that. It's not necessary. Main thing is, though, overall, have a healthy diet. Vitamin is never a replacement for a healthy diet. Whether you have any stage of macular degeneration, really that's, I think, the most important take-home message. Lots of fruits and vegetables, lots of nutrients, lots of antioxidants. Your heart doctor will thank you. Your eye doctor will thank you. Your family doctor will thank you. Don't smoke. Protect your eyes from the sun. And go see your doctor and find out whether the supplements are right for you. So that's all I wanted to say, but I'm happy to take any questions from anybody.
Good afternoon. I take the Vitalux, and it makes me so sick to my stomach that I actually have to carry medicine with me at all times to stop the nausea. I would really like to stop taking it altogether and have a diet. Is it possible to have a diet that would give me everything I need without taking these awful pills?
That's a great question. I mean, you're not the first person who's told me that the pills can make you sick to your stomach. I would say first try switching brands. Try a different brand, because it may be the other component other than the vitamin itself that, like the other things that make up the pill that could be giving you that feeling. So I would say first try switching brands. And then secondly, nobody's compared having a diet that's like super wonderful to the supplement directly. So we don't know whether, if you just eat a fantastic diet, is that good enough? We don't have any evidence to answer that question. We do know that the reason they came up with the pill was because they looked at people who had awesome diets and they said, what do these people eat? Why do they develop less macular degeneration? And that's how they came up with the idea for the pill in the first place. So absolutely, diet is the most important thing. I would say if it's making your life miserable and making you sick to your stomach, then I think if none of the pills is okay for you, then if I was your doctor, I would certainly say it was reasonable to stop taking the pill and just have an excellent diet. Is that as good as taking the pill? There's no way to know, but it's all a question of what's going to make you have the best quality of life. And being sick to your stomach every day or twice a day certainly doesn't sound like a pleasant way to be.
Hi. About 8 years ago, I started taking a vitamin from the Netherlands called Retina Complex. I haven't been able to find any other vitamin that sort of we can get here. And I was wondering if you had heard of Retina Complex, and if, in fact, anyone else is taking it, let's say. It was recommended to me by Dr. Ian at Sick Kids.
So there's several different vitamins aside from the age-related eye disease particular vitamin. Are you taking it for macular degeneration in particular? Okay, so our vitamins for RP are totally different. So the ones that we're talking about for macular degeneration and that particular dosing, if you have RP, you shouldn't. That's a different vitamin altogether. The ones that I'm discussing today. So anybody here who has RP, don't take my advice. We'll go to the other talk on RP and listen to what they're talking about over there. But yes, there's many different vitamins, absolutely, that even for macular degeneration that are, we don't know. We don't have the same. The only big randomized controlled trial for nutrients in eye disease, there's one for vitamin A and RP, and there's this one for age-related eye disease study in macular degeneration. And everything else is a best guess.
Hi, I have two questions. Is beta-carotene not the same thing as vitamin A?
So essentially, the vitamin A is broken down into beta-carotene. Beta-carotene is broken down into vitamin A in the body.
Okay, so when you
one is the precursor to the other.
When you buy vitamin A, are you buying beta-carotene?
Yeah, essentially. I mean, you're buying the further down product that beta-carotene becomes when it's in the body.
Okay, and you did actually just make a reference to my next question, which is that at an event like this last year in Ottawa, there was a nutrition discussion where a nutritionist and doctors indicated that for people with choroideremia, that they might benefit from having extra vitamin A in their system. So I have a 16-year-old son, and I've been making him take vitamin A ever since. And so but hearing what you're saying about the age-related macular degeneration, it's making me worry that maybe I'm doing the wrong thing. Where could I get more information specific to my son's condition?
So I think the best place would be you must have a retina specialist that sees your son. So that would be the best place to start, because the genetic, what we recommend in AMD and genetic eye disease is quite different. Okay. So certainly I'm hoping your son is not a smoker. That's probably the only extrapolation that you could maybe take from the ARED study, but otherwise don't assume that because it was worse in this population. Again, they were all patients aged 50 to 85, so not the same as your young son.
Thank you, Doctor. I have two questions. One is, what is the story on blueberries and walnuts? because I was told, and I put them on my cereal every day, and the blueberries are getting scarcer and scarcer.
And more expensive.
And I also wanted to know, what exactly do antioxidants do?
So the question about the blueberries. Blueberries contain antioxidants. They can contain polyphenols and anthocyanins, which are all, we think, healthy, good for you, but nobody studied it in particular in macular degeneration. So I can't tell you an evidence-based answer in terms of, it's going to help reduce your progression of this by X%, but they certainly are healthy for you, as are many other nutrients. So there's like 100 different nutrients we see in the drugstore if you go into that nutritional supplement aisle, and several of them say promotes eye health, but what does that really mean? We don't know. And that's the same kind of thing, exactly the same type of situation. It has good fats for you, healthy fats, which are healthy, good for your general health. But as to a specific thing for macular degeneration, we don't know. And you had a second question was... Oh, yes, yeah. So essentially antioxidants, it literally sounds like what it says. It prevents oxidative stress. So when you have high levels of oxygen in the tissue, you develop what's called free radicals or reactive oxygen species, which are these kind of little angry oxidized molecules that can cause tissue damage. And so there are certainly high levels of oxygen in the part of the retina where the nerve cells or photoreceptors are found, and the antioxidants help to prevent that oxidative damage.
Hi, just a quick comment for the lady and a question who said her son is taking vitamin A. Just that we don't know, in terms of beta-carotene converting to vitamin A, it isn't known in each individual how effectively you convert. So it's not the same thing taking one or the other, and high amounts of vitamin A can be dangerous. But that's something, again, to go with the doctor. I just thought I'd mention that. My question, and I don't expect you necessarily to be able to answer this about the study, but it's why did they pick artificial forms of vitamin E, like the DL tocopherol, versus a more natural form, and also about the zinc, if it doesn't matter the amount. I know high amounts of zinc can suppress your immune system over time, and the 80 milligrams is a lot, in my opinion, to be taking ongoing for years. So just questions about that.
Yeah, so in terms of why they picked certain component, like why they picked one form of vitamin E versus the other, I from what I understand, a lot of that type of stuff is just what was available for them to be able to put in the pill at the time that the study was originally designed. So for example, they actually put beta-carotene in the pill when they designed the first ARED study because they didn't have a commercially available form of lutein to put in it. So I think it just had to do with the practicality of, the study was designed, 5-10 years before results came out. So at that time, that's just what they had. And then once they proved it, then they're kind of stuck with using it. So I think that's probably the reason, as far as I know. And then your second question was about the zinc. So certainly, we do know that high levels of zinc can have some negative side effects in some people. But the study didn't show any, in those studies, that the patients who had the high levels of zinc were fine. There was no real increased rate of any adverse event. So that's why we can say either dose is fine. If you prefer the lower dose, certainly, I can't remember which brand, but one of them for sure has a lower dose of zinc compared to the other, or the two main brands that are available in the pharmacy.
I would like to ask, a person has other parts except the eyes. For example, she can sicknesses. There is different. Also, the same with vitamins is good for something. Why not take polyvitamins?
Sorry?
Why to take polyvitamins?
A multivitamin?
Multivitamin.
You should be taking a multivitamin. Even the patients who were on the regular, like the special eye vitamins, still took a Centrum Silver, even in the study. So as to, you should discuss with your family doctor, obviously, whether you should be on multivitamin. What
brand would you recommend?
That I would discuss that with your family doctor in terms of your general health. I know that in the study they took Centrum Silver. That was what they had an agreement with, but that could have just been who gave them the pill for free or whatever. So I would discuss that with your family physician.
Tell me what you're using, some vitamins, it's not good for the eyes, what you need good for the other sicknesses?
Sure, there's certainly other like B vitamins, for example, in heart disease. But again, that may or may not help the eye, but can help some other part of your body. But you would need to discuss that with your family doctor. Can it hurt your eye? Not that we know of.
Are there any eye drops that you can take that would also help to improve your eyesight?
Eye drops? Unfortunately, not at this time. There is research being done into eye drops as a treatment for wet macular degeneration, but it's still in clinical trials. So there's no eye drop that we know of that would help your eye, aside than if you have dry eyes, you can use drops for moisture in your eye. But unfortunately, nothing specific to the macular degeneration that's available on the market at this time.
All the normal consumer multivitamins appear to contain beta-carotene. I've had trouble finding any that don't, and they have different levels. Mm-hmm. Is this a problem? And if so, do you have a recommendation for a multivitamin that does not contain beta-carotene?
So the dose that they studied in the ARED study was 15 milligrams in particular. So we only know that that dose was the one that may have increased the risk of lung cancer in people who had previously smoked. Any dose other than that, we don't know. We don't know what would it be if the dose was lower. And you're right, many multivitamins do contain beta-carotene, so I wouldn't worry about it if it was in a small dose. If it was something higher, then that is certainly a cause for concern. But in terms of a particular multivitamin, that I don't have one that I specifically recommend.
When you say higher, you mean higher than what?
15.
15 what?
15 milligrams.
Okay.
So thank you everyone. Thank you to Dr. Bakshi.